Welcome to Truth or Trash, Health Information Online. In today's program, we're going to look at how to evaluate health information that we search for online. I'm Lorraine Sheldon from the UNT Health Science Center Library. I am the Community Engagement Librarian, and our campus and library are located in Fort Worth. Just to give a little bit of background, the UNT Health Science Center is a graduate level academic medical center, and we have 6 different schools that train health professionals, such as DOs, MDs, public health, physician's assistants, PT, pharmacy, just to name a few. And our mission at the university, and part of the reason why we're here talking to you today, is to create solutions to healthier communities. Our library specifically is a part of a national network for the National Library of Medicine. So across the country, there are several regions, and they serve as a network to the National Library of Medicine, which is actually the largest biomedical library in the world. And it's a part of our federal government. So medical school libraries across the country serve as resource libraries for the community. So they don't just serve the populations of their schools, but really they look outwardly and work to help create positive health information for the community. So our mission as this type of library is to really improve public health through increased access to health information. We do this by providing access and resources to free and reliable health information. And we also do this through partnerships with your public libraries, community organizations, any partner who's interested in kind of removing barriers to health information, specifically quality health information. So to start, we're going to look at this concept of health literacy, because this really motivates why we're looking at health information online. So in general, information literacy is that ability to locate, evaluate, and use information effectively. So in the case of health information, it's use it effectively to make health-related decisions. And it's important for a number of reasons, one of which is to help us think critically about decisions and be well-informed. So looking at e-health literacy specifically, there's some interesting data that exists. So in 2019, the Pew Research Center did just a survey of how many adults in the US use the internet. So 90%, 9 out of 10 adults are using the internet. And that might not be a surprise, but close to 96% of adults also own a cell phone, 81% of which are smartphones or designated as smartphones. And that's really high when it comes to statistics, 96%. So when we're looking at that, when we're thinking about e-health literacy, the same research center did a poll in 2012 that found 6 out of 10 adults regularly go to the internet for health information. So that was 8 years ago. They do this study every 10 years. So you can see from that period to now, with the increase of people using the internet, those who have it accessible through their mobile phones, that number is probably quite a bit higher. When we dig into it, a more recent study shows that adults act based on health information they find online. So this is a graph that does it based on age groups. So these are the numbers of that show, for instance, the difference between, proposing a treatment plan to your doctor based on what you found online, asking for prescriptions based on what you've seen online, or proposing a diagnosis. So these different charts show how likely a person in a particular age range, having found information online, is willing to ask their doctor, hey, I found this, I'd like you to do this. So, which is unusual, unprecedented in medical kind of treatment historically. So we have all this access to information at this point, and seeing, say, the 60% range, 50% range, depending on your age, that you would use information online to engage your doctor is really relevant, really prominent and a good reason why you're probably watching this video today and why you're interested in this topic of evaluating health information online. We'll look at one last one, which was somewhat fascinating, looking at the kind of things that people search for in terms of healthcare problems on search engines. So in our current climate, it might be that COVID symptoms are probably the highest search things. But at this time, last summer in 2019, it said that mono symptoms, pneumonia, depression, Lyme's disease, these were some of the top search symptoms related to health that were out there. And others include shingles, meningitis. So there's information tracked about what you're searching online as well. So keeping that in mind in terms of privacy and your health information, your e-literacy, and understanding that. So I wanted to give this kind of basis for what we're doing, kind of what we're looking at and why we're looking at health literacy and looking at information online and recognizing, is it trash, is it truth, and being able to apply that to our health decisions. So let's start with truth. And I should say with a disclaimer that, we're not assuming truth exists. We're moving from the foundation that there is quality information out there that we can trust, and we're learning how to find it. So we're going to start with an exercise. It's called the 10 Facts exercise, and you can do this along with us. So as a group, we're going to look at a described object or condition one fact at a time. So on the screen, they'll pop up one word at a time, and just based on the information that you're given, will you be able to identify what it is describing? So yeah, after each additional fact, you'll decide what is being described until you identify the object. So let's look at our first object or condition. So I'm going to show on the screen one word at a time again. And at any point, you might figure out what is it that's being described. Did you get it? So what is being described with these words is a myocardial infarction, or in layman's terms, a heart attack. So each word kind of gave you a clue about what it was, but it wasn't until you had all the words were you really able to describe or identify what was being looked at, what was being described. So I like to discuss when we're thinking about this, this old parable that has been made into a poem by John Godfrey Sachs. It's actually a really ancient poem about blind men and the elephant. And I'll just read this beginning part of the poem that was written in the 1800s. So the poem goes, "It was 6 men of Indostine, to learning much inclined, who went to see the elephant, though all of them were blind, that each by observation might satisfy his mind." So in this analogy, it goes on, and each of the blind men describe a different part of the elephant with conviction. They're like, this is what the elephant is. Not all recognizing that altogether they had a full perspective of what the elephant was, who the elephant was, or how you would describe it. So what does this say about truth and what is required to find truth? So some things we might glean about that is that, it takes research, it takes effort and collaboration with others to find information, to know if it's true. And this is a really great point where you might mention how important it is to work with a health professional and not to just self-diagnose. It's really important that one of those collaborators you work with is a doctor or your doctor. And what is required to find truth? Multiple perspectives again. So I like to use that analogy, that kind of historical story to help us understand our search and investigation of what is true and not true, just to establish that when we're looking at information, particularly information online. So one of the things we have to come to terms with also is that we each have individual barriers to truth, whether you're a healthcare provider or the patient yourself. Appreciating and understanding that is really important. So some of these barriers include biases, which is the inclination or prejudgment against someone or something. So maybe it's a particular perspective on a treatment that you've already established in your mind. And biases, they describe it, or they categorize these biases into a couple of categories. Ones that kind of originate from an unclear of what to remember. There's a lot of information, you're not sure what to remember, so your bias kicks in and you remember what you're used to, for instance. Or again, with a similar vein, there's too much information, you're overloaded with information, and again, you're going to be biased to what you've already been inclined to. Not enough information is another kind of bias, either not having access to enough information or just limiting yourself in general. And then the last is the need to act too fast. You have to make a decision very quickly, so your biases kick in because of the immediacy or that need there. So sometimes there are instances where fear is a barrier to health information because, one, we're afraid of what we might learn, or comprehension. Health is a complex issue and it has its own language that doctors spend many years learning. So we might not comprehend well what is being described to us. Possibly a mistrust of the medical field. That's a barrier we'd have to overcome. Or you just can't find resources. Maybe you have a particular condition and it's difficult to find information. So these are different barriers, and you might consider, what are other barriers to truth? So I'll give you a second to think about that. So now that you've maybe formulated that in your mind, some additional ones could be, a language barrier, or maybe a digital divide, that lack of information because you can't get to it. Other just might be literacy. There's numeric literacy, there's language literacy, there's digital literacy. These are all barriers potentially to truth. And this isn't to overwhelm you, it's just to know what we're coming up against, what we're experiencing. And I could say personally, from my personal experience as a breast cancer survivor, when I was first diagnosed, I definitely experienced that fear barrier. I even as a health professional, as a information professional, I received my diagnosis and I kind of shut down. I didn't want to know more. I couldn't know more. And in that case, actually, my doctor had told me over the phone what it was. And because, the stress of the situation, I couldn't even register what kind of breast cancer I had. I knew it was a common one that really stuck with me, but the words, the invasive ductal carcinoma, that was big. I didn't understand what that was at the time, so it didn't really stick. So there are these barriers that exist even for people who are thinking about health information all the time. So don't feel like you're at a different starting place. We all have these experiences. We all have these barriers. So I wanted to share this diagram. It just shows you how complex, say, bias is particularly, and it breaks it into those 4 categories that are described. And I'll provide a link to all of our resources that are referenced here if you want to dig a little bit deeper. But it's actually a really beautifully done diagram, and it really breaks it down, all the cognitive biases that might exist if you just want to do some extra additional work. So all this to say and to establish about truth or information in general or knowledge is that certitude maybe isn't our goal. There's an excellent quote from this book, The Misinformation Age, How False Beliefs Spread. And it says, perhaps we can never be certain about anything, but that does not mean we can't be more or less confident, or that we can't gather evidence and use it to make informed decisions. So our goal really here is confidence. We may never know certainly that this is the perfect decision, but that perfection, that certainty isn't the goal. It's really to gather as much evidence and information so that we feel confident and we can move forward with our health decisions, and really any decision if you apply this to other parts of your life. So let's get into this specifically of trash. How do we identify what is trash? So in this program, we're going to look at 2 different strategies for identifying trash. So this first one is the 5 quick questions, and it was put together by the National Center of Complementary and Integrative Health. So they use the 5 W's, which is usually 6, but the 5 in this case, to really remind us and to use as a toolkit for when we're looking at a particular source for the first time. So the question you might ask is, who is running or created this site or website, and can we trust them? Are they a trusted source? Next is what is the site or app promising to offer? And does it claim something that's too good to be true? When is the information written? This is really important for medical information. Is it up to date? And in this case, we think about up to date in the terms of, say, like the past 5 years. That would be like the gold standard, 3 to 5 years. Where does the information come from? Is it based on scientific research? So compared to other resources or information online, health information is usually cited. They usually provide their references at a good resource. Not all information online is going to have that standard, but for health information, that is usually a quality indicator if they're willing to say, this is where I got this information, and show you how recent it is, for instance. And then lastly is why. Why does this site or app exist? Is it selling something? So what is its purpose? Why are they doing this? Is it the good of their heart? Is it to sell something? Is it an organization that is focused on a particular condition or circumstance? These are the kind of questions you can ask yourself when you first initially go to a site. So that is our first tool. Now let's look at our second tool. So the second one is the CRAP test, or CRAP test. So for those who aren't familiar, what this is referring to is currency, relevance or reliability, authority, and purpose. So we're sharing these 2 different strategies or methods, so you can use the one that sticks for you, whatever is helpful for you to remember. So there are a lot of similarities. So again, with currency is this source current? Is it in the past 5 to 10 years? Because particularly health information is rapidly changing. We're constantly learning new things. Is it relevant or reliable? Does it directly address my need? Is it an opinion? Who is writing this again? And what are their references that are provided? So again, that's relevance, reliability. Similarly, authority. Who is the author of this source? Are they just an individual? Are they a blogger? Are they a medical doctor, a nutritionist, a health professional? So are they an expert in the field? Are they a well-known organization? Is it from a reputable source ending, say, in .gov or .org? So looking at those endings of your web URLs. And lastly, is the purpose or point of view, is the purpose of the source, again, to educate? Is it to advertise? Is it to sell? Does the author have skin in the game, basically? What is, again, their purpose? What is their motivation for putting this information out there? These two different methods are very similar, and I just want to make sure that everyone goes home with these tools in their pocket, so when they come across something, they can be like, oh, you know, maybe I shouldn't trust this because they don't do these things, or they don't clearly state who the author is, or various things that you might look at. So analyzing digital information, well, okay, I have these questions in my pocket, I have this toolkit to ask myself, but where do I find that? So looking at specifically digital information online, there are various areas that you can look. So the domain name, just the web address, what is the address for the website? That tells you information. So what is it? Is it a .gov? Is it a WordPress or a blog? Looking at the address is going to tell you something about that resource and whether it's trustworthy just from that starting point. And maybe there's a case, for instance, I know for Tarrant County has a .com, Tarrant County Public Health. And you would still say that as a reputable source. So these ideas that, you know, .com is automatically bad, that can't always be applied. So just think critically, but we do recommend, say, .gov or .org as maybe trusted before others. And definitely trusted before blogs. Then there's About Us. So most, if not all, websites have an About Us page, and this is going to tell you a lot. This is where you can really dig into who is sponsoring the page, what are their credentials, what is their aim and mission, do they have guidelines for providing the information or vetting the information. That can all be found on the About Us page of websites. And we'll look at a couple of websites and show you where that is, where that information can be found. Citations. So again, citations might live at usually the bottom of a page for health information. They don't always embed it into like an in-text citation in an article or resource. But if you scroll to the bottom, that's where you're gonna see the date it was created, any kind of resources they're referencing, generally at the bottom of a page that's providing information. Finally, let's see, looking at appearance, that's another part of looking at digital information. Does the website look out of date? Not every organization has the funding to say keep their look and feel up to date, but quality resources generally do. Again, you don't want to use a blanket, oh, this looks like it's from the 90s, I'm not going to use it. But this is more likely than not a measure of quality, or at least up to dateness. The writing style, does this information make sense? Are there grammatical errors? Is the style of writing satirical or persuasive? When you're looking for health information, you generally don't want opinions. You want to find hard and fast facts as much as you can to your best of your ability. Again, like if you're just wanting to know of people's experiences, say with a particular condition, you're not looking to understand the condition, you're obviously more than welcome to look at those. But just knowing that, you know, in terms of scientific information, you're going to want to look at the tone and whether it is written properly. What do others say? So look at the reviews for the site, check it out on social media. That's one way to also investigate the digital information. Look them up on fact-checking sites. So one might be Snopes, and just healthy skeptical. A healthy bit of skepticism is always good for kind of searching the internet in general. So again, an overview of how to spot trash online is, can their information be verified? Are they citing things correctly? These are just immediate red flags. Are they intending to provoke emotion or using clickbait titles, just really catchy phrases just to reel you in? Are they being misleading? Is it personal blogs, or is the author an expert? Is an opinion or editorial? So these are just really quick things that you can know in the back of your mind when looking at a new resource to know whether this is quality or not. So maybe we can take a moment here and look at some examples of both quality resources, resources that you might stumble upon or use regularly, and really figure out, is this a good resource? Okay, at this point, we're going to look at some example websites and where to find the information we discussed and how to know whether it's good or not. So we'll start at one extreme. And this is an example of a website, for instance, it's called HealthNet News. So just based on that title, you're like, well, maybe this is a reasonable place. It's obviously about news. But already looking at the front of the web page, you can tell that it has somewhat of a blog feel. And really that's what it is. It's curated by one individual, this individual here. And, the first thing you see is that, she's trying to get you to download her book or read her book. So when you look, for instance, at her health information, they have a whole list here. But we'll give one example of what she is saying. So in her kind of website, she's actually, kind of from her own opinion, sharing news about health from other sources. So kind of through her lens. So this is a particular example. So from her opinion, what are her thoughts on these things, and quoting it. So in theory, like maybe the original source is potentially reliable, possibly. But again, this is coming through a lens of someone who's not necessarily a professional. She does list her sources, which is one of our criteria, but we have to appreciate that, maybe one of these sources has biases. Who is the author of that information? And when you look at her information as the founder of this website, she isn't actually a medical professional. She describes herself as a longtime activist with a passion for the healing arts. So again, there's a place for opinions, but if we're looking for information to make decisions on for our health, this isn't a recommended area or website that we might have. And you can see, again, using those other tools like the About page, you can see about this person. And I don't mean to talk disparagingly about her, just to say that, this is one type of source, and maybe it's not definitely not our first choice if in terms of making health decisions. You want to talk to a health professional first. So the next example is, let's say, WebMD. So a lot of people do use WebMD, say they do a Google search or a search engine search for a particular health issue. WebMD might be up there. And just to understand a little bit about WebMD. So again, using our kind of investigative skills, I'll show you a great place to start when looking for information about a website is just scroll all the way to the bottom. And pretty much all websites, or any good website, will have kind of a website map at the bottom of their page. So again, this is where we're going to go to their About page and learn more about their policies and what is important to know about them. So let's go to About WebMD. So again, like they have several policies here. So again, when we're thinking about, well, what is their motivation? Advertisement is part of their motivation. So this is a .com, as you can see from the URL. So they're a company. They need a revenue source, that their purpose is to make money. It's not just to provide information. So they do have that advertising and policy area. Editorially, they have the mission to be objective and truthful and accurate, which is great. And you can see, they're also looking for relevance and kind of thinking about their integrity. But I will point out, so again, we know that they're advertising. They have an area for privacy. So you're looking at health related information. Maybe this is a naturally private information. And when you look at what they describe here in the website, you have to dig deep again. But they say, if you don't want us to collect or use or disclose information about you or use of the services as described in the policy, you should not use this service. So in this case, this website is harvesting, is collecting what you're searching. So if you're comfortable with that, then you can move forward with this website. But again, we're looking at degrees of information, degrees of resources, and just being conscious of what is there, what is their policy, what are you willing to give away? Like, are you willing to be advertised to? Are you willing for information to be collected? And if you are, that's totally fine. So again, it's a spectrum of information, and these are just examples. So it doesn't mean WebMD's information is inaccurate. It's just, a cost-benefit analysis. What is the cost you're willing to give? Another we'll look at is an organization. So the American Heart Association is one that you might be familiar with. Again, we're using the About Us area. We'll go to About Us. You can see they have history, diversity, inclusion, advocacy. I'm again going to go to the bottom and look for their About page. And they're an organization that's been around for over 100 years. Their mission is clearly stated, to be a relentless force for a world of longer, healthier lives. And what I'm going to point out here is that they clearly illustrate and tell you who it is that's kind of managing this organization, managing this website. You can see that many of the people that are on their staff and later who are on their board are medically trained health professionals, some with several degrees. So you can be even more confident in the resources they're providing. And to give an example of a resource, they actually have guidelines related to various things, guidelines in terms of stroke and whatnot. And we'll go into this here in terms of a health resource. And we'll look at their PDF. It's really accessible. And when you look at the source, this is like any kind of professional source. It actually has a digital object identifier, which is highly professional. They have many authors that are part of the committee that are putting out this information. They clearly describe their methods and conclusions and summaries and where this information is coming from. So this is definitely a source you can feel confident in, confident bringing, say, to a doctor's appointment and talking through with your doctor, and feel confident that this is a quality resource. This is to the standard of a medical journal. And actually it is in a medical journal, the Circulation Journal here. So we're going to look at this point at a couple of resources that are provided by the National Library of Medicine and the National Institute of Health just as a toolkit that you can have in the back of your pocket. So you don't always have to investigate, is this a quality resource? So you can just know right off the bat, yes, it is, because we've gone through it today. You know and feel confident in it. So the first we're going to look at is Medline Plus. So Medline Plus is, again, put together by the National Library of Medicine, and which is the largest biomedical library in the world. So along with doctors and information professionals, they've curated this information, and it is, again, provided by a federal funded. So you've already paid for this information. You won't be advertised to. The purpose really is to provide trusted health information to you. So the motivation is clear. And again, like other websites, you can go to, say, the About page and learn about what are their guidelines, how do they develop information for various things. You can see that here, the disclaimers, privacy, various guidelines for why things are linked. But going back to the main page, the way information is arranged here is in 5 different areas. The first being health topics, then drugs and supplements, genetics, medical tests, medical encyclopedias, and lastly, just healthy recipes. But that's just a fun addition. But really, it shows that, like a lot of information, there's a lot of specialties and areas within health. So maybe you're wanting to know about a particular disease, or you're wanting to know about a pharmaceutical drug and its side effects. That just like, say, a dictionary versus a thesaurus, you're going to use these in different ways, and information is arranged in different ways depending on your need. So just being conscious of that. So we'll look at a health topic briefly. These are the ways that they're arranged, either by body location, by disorders, a variety of different ways, or just A to Z. But maybe the way you want to look at it is up here. So we'll say diabetes. So I did my search, and again, this first one is a health topic that has been curated already for me. So every health topic has these basic information outlined in each one. So they're all going to have a summary, a starting point where you can learn more, specifics on different demographics. But it's just a nice summary of what is this. They clearly state where the information is coming from, and give you really a starting off point, a jumping point to other quality resources. So you don't have to put in the labor of knowing, is this a good resource or not? They've done that for you. So you can see here. And when you scroll to the bottom, you can see here the page when it was last updated. So already it was updated in September 2020 and reviewed again in 2017. So that fits within our criteria of 5 years, 5 to 10 years. And again, like they clearly state where the source is from. Say it's the Medical Encyclopedia or the Center of Disease Control. You know, this is hitting all those different questions that we were concerned about, reputable sources, the date of these resources, different things. So we'll go again to the drugs and supplement area. This is actually my favorite area of Medline Plus because you can search for different information on generic or brand names. So we'll just pick one. We'll say tamoxifen. So each one of these drugs, whether you search for it as a generic name or otherwise, clearly answer all of these questions as well for every single one. So if you're wanting to know why it's being prescribed, how this should be used, if your dose, what happens if you've forgotten anything, any question you might have. I find it particularly helpful for side effects. These are common side effects for the drug, but then they have an area if for more severe side effects that you know, are an emergency if you start to feel these. And these are definitely helpful if you're experiencing them, whether to know, okay, this is just normal, or I definitely need to call a medical professional immediately. A new area is the medical tests. So they have a variety, again, of medical tests that are commonly prescribed, excuse me, from your doctor that you can look more into about why, what it is, what it's used for, what the test results mean. So again, there's many tools that are useful for you. Another resource we're going to look at is Pillbox. So it's pillbox.nlm.nih.gov. And what's nice about this is, say you are taking multiple prescriptions and you've dropped one, you don't know what it is. It's important to make sure you're taking the right medication, or you find something on the ground. You can actually kind of reverse find it. Every drug has an imprint on it. You can put the imprint, the shape of, excuse me, the drug, the color, and you kind of reverse find what it was. So we could just make up a particular drug, and it doesn't have the picture. Let's see. Let's try another one. You can see, okay, you can figure out what it is by kind of reverse finding things. Another one related to medication is DailyMed, again, .nlm.nih.gov. And what is nice about this particular resource is that, say you've lost the box for a drug, you can actually look it up. We'll do a search. And you can look at the actual box to know, okay, what is it saying? How should I take this medication? What are the active ingredients? So they have that for a number of different prescriptions. We'll look at clinicaltrials.gov is another resource that is useful. Again, as I mentioned before, I was a breast cancer survivor, and initially I wasn't comfortable with the idea of chemo. So knowing my condition, I actually looked up were there any trials that I could be a part of first, and looking through them to know, okay, yeah, what is available to me. And many research studies are required to put their information on here. So this is a pretty comprehensive database of all the research that is currently being studied. So you could put in a condition, say COVID. COVID-19, do a search, and see all of the different studies that are currently happening. There's over 3,700 at this point. The last resource we'll look at is called PubMed. So PubMed.gov is actually a database. So a database is basically a record for a journal articles, for instance. What is like a summary of what is the journal article about and its catalog. So it doesn't have the full article necessarily, but it is going to tell you, okay, what is in this journal, and you could potentially get it, say, through a library network, or in a lot of cases, there are full text available right in Medline Plus. So again, you could do a search for a particular disease, and you can see there's quite a number of results. So this is the kind of resource you're going to go to if you have, say, a really specific condition that isn't just generally talked about in, say, health topics, for different health resources, but are maybe a bit more specific. So this is where you would go for that. Medical professionals, medical libraries. This is one of the go-to resources to find the latest information about a particular health topic. And we can look at more detail. So you can see here the title, the authors, what is it about. And in my case, since I have access to a library, I can get my full text through a various source. But if, say you're limited, you can actually click here and see just the articles that have free full text. So this is one that has full text freely available. And you just click on this button here. And you can see the full article. So that was a set of freely available resources, kind of a spectrum of their qualities that are available, and what you might find on the internet as examples. One last resource we're going to look at, we created locally for our community in the North Texas area, called the Hope Directory. And really it's a list of local resources, community-based health resources, if you have a particular immediate need, say a need for a food bank or a need for eyeglasses or a dental clinic. That's the kind of information you'll find on the Hope Directory website. So let's take a look at that. You can just type in hopedirectory.org. And it'll bring you to this main page. So you could do a search specific to your city or zip code, the services you have. You can look up by organizations, programs, or events. We have some featured programs currently. And of course, there are our guidelines, privacy, information about us and why we've created this. But let's look at organizations. This is a nice way to look for quality, for different things. So again, you can look by age group, what is relevant to your age group, a particular audience, or condition. But let's look just at by name. So when you do a search, whether it's the search bar or otherwise, you can see here the list, the name of the organization, their host organization, their days of operation, and their location. So we'll look at the JPS Health Network Dental Clinic. So again, it'll say even more details about them, about their organizational services, who they serve. You can see where it's located and look closely. You can find them there. We can, in this case, there's a whole slew of different ones related to this. Looking at their behavioral health, you can actually see their specific programs related to different things, so like family support. So this goes deeper into a specific program, and you can download a PDF about that program, when they meet, how frequently, their cost. Generally, the cost is free. But again, this is a whole database of curated local resources for us in our North Texas area. So now that we've gone through these various resources and know about them, we can practice. So I've included some practice examples here for you, and I'll just leave them on the screen for a period of time so that you can read them and try it for yourself. If you were in this particular situation, what resource would you use? Why would you use it? Think about that thoroughly. So our first scenario is you accidentally drop your pill box and do not know which pill is which. What are the following 5 pills and what resource did you use and why? So at this point, you maybe want to pause the video and think through this. So the resource you probably want to use in this instance is Pillbox. So again, that's pillbox.nlm.nih.gov. And you can, using the information that you can see on these particular images, you can identify what are these, and we use that for that particular reason. That's why we use that resource, because we could reverse engineer and find it that way. Our next example. Your dad was just diagnosed with diabetes, and you want to know more about what foods he should eat and those he should avoid. What specific pages and from the resources discussed today would you print out for him? What resource did you use and why? So again, at this point, maybe you want to pause the video and think. So at this point, maybe the resource you would want to use is Medline Plus. You can look up diabetes and find kind of health sheets that describe it. What is it? There are links to different other organizations, such as the diabetes organizations, that kind of go into this detail and that you can print off. You could also alternatively do a Google search for this particular search, and just be careful to use the tools that we've learned today to know, is this a good resource? Okay, let's go to our next example. You were taking warfarin. You would like to know if there are any foods you should avoid. If so, make a list of foods that may counteract with your medicine. What resource did you use and why? So again, maybe pause the video here. So one resource, again, that we mentioned earlier was Medline Plus. So you could look in Medline Plus in the drugs and supplement area, search for warfarin, and look at the counteracting foods that might affect your medicine. So that detail would be in that area of that particular resource. Alternatively, maybe you could do a search for this kind of warfarin and food aversions in PubMed. That might be a little more complex, but that is a potential that you could look at. So that concludes our different examples. I hope you've enjoyed our program today. At this point, I'm going to show our references that we used in the program, and also include a title screen for how you can reach us. So if you have questions, if you have like a search you'd like us to do, or just need help with health information online, our library would be happy to partner with your local library and work with you to resolve and help you find things you need to find. As librarians, we love information. We love being detectives and finding information. If it's not through journals or books or online resources, if we can't find the information, then we can also reach out to health professionals. We have access to many great individuals here at our institutions and other institutions that can really help with your search, with your ability to look at information online. So we truly hope you enjoyed this presentation, this program, and if you've made it this far, congratulations. Thank you so much for engaging, and we really hope you enjoyed it and look forward to serving you soon.